What I have to the top left here is a diagram of the posterior knee, and this is the right knee specifically. And the reason why we need to know all these landmarks is that we begin to orient ourselves. So if this is the right knee, this is going to be the lateral side, and this is going to be the medial side. So the medial side points towards your midline. And so based on that, we can now say that this is going to have to be our femur, which is that main big bone in your thigh. This guy on the lateral side is going to be your fibula, and sometimes you'll just hear people say fib. And then this medial bone in your leg, going from your knee down to your ankle, is going to be called your tibia. And again, you'll sometimes hear people say tib. And so when you take a look at this diagram, the key thing that I want you to see here is that on the medial side of your tibia, you've got this ligament that goes from this part of your tibia right here, and it connects to the distal end of the femur. So the distal end of the femur is going to be the bottom part of the femur. And so you basically got this ACL, I'll write this in, anterior cruciate ligament, that goes from the proximal side of your tibia up, and it connects into the anterior side, or the front side of this femur on the distal side of it. So I know that's might be a lot to take in, but if I was to diagram a guy and he's sitting like this, so this is going to be his anterior side, or the front side of him. That's going to be the posterior side. Sorry. That's the back side of this guy. What we're looking at is his right knee specifically. So this is that region of interest for us right here. And so if we were to zoom in on this, I'm going to draw these bones so we can begin to look at them in a slightly better way. And apologize, these drawings might not be as beautiful as I could make them, but just to hit home the points. So the bone that's going to be superior is going to be that femur. I'm just going to write it as F. The bone below that is going to be that tibia. This is the bone we care about, so I'm just going to abbreviate this as T. And so the thing that we just talked about was that ACL, and that ACL is the thing that goes from the proximal end of the tibia, which is going to be this guy right here on the posterior side, and then it's going to move to the anterior side of the distal head of this femur. So it's basically going to do this, and it's going to make a rope that's just like this. And so in addition to an anterior cruciate ligament, there's this thing called a posterior cruciate ligament, which you can see in this picture right here, which is doing the exact opposite of what the ACL is doing. It's stabilizing the opposite direction. So the key thing to take home, and I'm going to add this in just for the sake of completeness. So on the femur, what we're seeing is that on the posterior side of this femur, we've got this guy right there, and he's going to connect with the anterior side of the tibia like that. And so basically what we end up with is this X pattern inside of our knee that's holding our knee together. And so what happens with an ACL tear? So ACL, the anterior cruciate ligament, does the following. So if the tibia is fixed, so if we're not letting our tibia move, it stops anterior sliding of the femur. So that's one point. And then another thing is also, if the tibia is fixed, if the femur is fixed, it stops posterior sliding of the tibia. And I apologize, my handwriting is not the best, but hopefully this makes sense. So let's say you're a doctor in an exam room with a patient, and you suspect that this patient might have a torn ACL. So you, the doctor, would be sitting here in front of the patient's knee, and that's a bad drawing, but who cares? But basically what you're gonna do if you suspect an ACL is torn is two things. So on this right knee, what you can do is you can hold the femur in one place and then try pushing the tibia backwards. And so if the tibia is able to move backwards in that posterior direction, then that indicates that the ACL is torn, because what happens in this case is that this ACL right here, something happened in this guy which basically severed it. So that rope that ties together that femur and that tibia at those two locations has snapped, and it's allowing you to move this tibia way farther back than you normally would. Alternatively, what you can do is you can stabilize the other leg. So if you stabilized the tibia, if you hold the tibia, the lower part of that leg, and you try pulling the femur towards you, so pulling it anteriorly, if that is able to happen, then that also indicates that the ACL can be torn. So these are the key things to take home. So how do you test this stuff? And the other thing I'll note is we're going to see the size of this guy, the ACL, much bigger area and volume than we're seeing with our PCL. Why is that? So in life and over evolution, it's been much more common that people will get some kind of traumatic force hitting their tibia head on. So if you were looking at a dog and the dog was charging towards you with a ball and the dog couldn't stop in time and it basically hits you right in front of your knee, that is going to create an immense amount of force on this tibia. The immense amount of force on the tibia, while the femur isn't moving, is going to put a ton of stress on that ACL right here. And so that stress on the ACL is what causes it to snap. And so when that snaps, that's when you no longer have this stabilization that you normally would get. And that's when you need to start turning to physical therapy or possible surgeries. But that is the key thing to take away here. Why is it less likely, or why is it that we're seeing that the PCL, the posterior cruciate ligament, is so much smaller? Is because it's a lot less likely that someone, or a dog, for instance, is going to come charging. So if I had my dog and the little dog here is moving very quickly and charges into the back of the leg, is a lot less common than the dog coming from the other way directly head on and hitting that tibia, kind of like cutting your knees off or whatever. But that is the key thing to take here in terms of ACL ligaments. What is it stabilizing? Why is it so much bigger than the PCL? And how can you test it to see if it's indeed torn or not? So I hope this is interesting and helpful. Let me know if you have any questions. I hope everyone out there is doing well. I'll talk to you guys next time.